You were just also telling me about some exercises you were doing, reps or something that you didn't think you could be doing before.
Well, I do terminal leg extensions, the last 15 degrees.
Right.
Mostly for this in here. And in the past, that was one of the things that kept my knees functioning pretty well. And, I'd kind of gotten away from doing them. It hurt, it was hurting.
And now?
And today I did more than and more reps, and I start off with like 100 pounds on each leg and do these things like this, and do like 8 to 10 reps, and then I drop it to 90, and then I drop it to all down to 60, and do about a dozen reps with each one. In the past, I mean, even 2 or 3 weeks ago, it was hurting on my knees a little bit, some of those places would be a little pain here and there, but today it was really good.
Great. So you would say this has remarkably changed your life.
Oh yeah, it's getting better all the time.
I love it. Is there anything else you'd like to tell the viewer?
No, but I sure like to see this stuff tried on some of my patients. They've got ligament laxity in the cervical spine, or got lumbar disc issues. I want to see how it works.
Thank you. You know, I'm treating patients like that.
Yeah.
Although they're not your patients,
No.
I am getting really nice results.
Yeah, and I want my patients in here, but the problem is the money for most of them, and it would be very helpful for a lot of these car crash victims to get in here and tighten up those
Oh,
ligaments
yeah.
in the neck.
Thank you. And it would also help your work too,
Oh,
because there would be fewer adjustments that they need if the
Yeah.
ligaments were tightened up. Is that correct?
Yeah, and that's the problem when they get that ligament laxity where the vertebra slides forward, and when they extend the neck, the vertebra slides backward. They get like 3 millimeters of total translation there. Is, according to the AMA guidelines, it's up to a 28% total body disability.
Oh, wow.
And I've got patients like that, lots of them. And if we could tighten it up just a couple of degrees, that would be, it would cut the chiropractic visits and the massage visits and everything, down to a tenth of what they were getting.
You are an honorable man. None of us like revolving doors. I don't. I like my patients, and I'm sure you do, to get better today so they don't have to keep coming back.
Yeah, and if they get better, then the insurance companies are happy to pay for their
Yes.
treatment. Except for no insurance company wants to pay for ozone or even prolotherapy for that matter.
It's so sad considering that they're very quick to pay for a joint replacement at maybe 100 times the cost. Yeah. Okay, do I have your permission to use this video?
Yes.
And may I post it on YouTube?
Yes.
Thank you. One last question. Is there any discomfort associated with these joint injections?
Sometimes there is a little bit, especially when the knees are really swollen and there's not much room to put that stuff in there. But it's like today, it was like, what happened? What are you done yet? No, you're already done. The needle's out. I didn't feel a thing.
Okay,
And
thanks.
that's the nice way. And sometimes it's a little slow down a little bit, and but you're usually pretty good about backing off. When my face says it hurts, you slow down a little bit, and that's a good thing.
I read your face.
Yeah,
Good.
I try to express myself.